Hello, everyone, and welcome to another Whiteboard Wednesday from Advocates for Human Potential. Each Whiteboard Wednesday, we take a quick look at issues affecting public health and human services organizations so we can give you real world solutions for real world problems. Hi, I'm Kristen King, and I'm the lead for online events and digital strategy here at AHP, which includes everything from live social media events like this one to webinars to virtual classrooms to massive online conferences and more. Today, I'm joined by my friend and colleague, Patrick Gauthier, who is AHP's Director of Healthcare Solutions, and I'm going to add Patrick to the stream. Hi, Patrick.
Hi, Kristen. How are you?
Good, thank you. Some of you may already know Patrick from previous Whiteboard Wednesdays or from consulting with him. But for the new folks, Patrick has 30 years of experience in management on both the provider and the payer sides of healthcare. He's developed staffing for behavioral health programs as well as for managed care operations. And since 2005, he has guided many of our clients here at HP in development of their staffing and workforce development plans. So, Patrick, we have a webinar coming up on October 28th about behavioral health workforce development planning for ACOs. And today, we're going to lay the groundwork for that larger conversation by really looking at understanding the continuum of the behavioral health workforce, because there's a lot more to it than it might seem like at first glance. So, tell us why this is so important for ACO behavioral health.
Well, great question, Kristen. Let me give you an example. We worked with a medical detox or detoxification program that wanted to expand its outpatient mental health and substance use disorder services. Of course, then they needed a staffing plan. They were new to this. And that staffing plan would help them ultimately to optimize their revenue while delivering the services that were needed in their community, particularly since this was around the opioid epidemic.
Mm-hmm. Okay. And those needed services are going to look different for every organization. So, it's not one size fits all. It's a pretty complex decision. How do you determine the level and the type of staffing that are going to do that for a given agency?
Well, exactly. You're right on point. It wasn't just about hiring staff, saying we're going to now go hire a bunch of behavioral health staff. For this particular client, we had to look at the population data in their service area to identify the unmet needs in the community and the level of demand. They had a sense, of course, in their emergency department of what the level of demand was, but we wanted to know specific what that level was. And then we had to understand what their plans were for their own behavioral health program. This becomes a program within their facility, and they certainly would have plans for that. Once we knew both those things, we were able to capture the skills and the competencies that would be necessary at each of the staffing levels to supply what was being demanded.
Well, and there's so many different types of behavioral health professionals and so many ways to combine them depending on our service mix and goals. Like we might know that we need one role, but we don't know how many of those people we need. So, walking through these different options today is going to really help us, like I said, lay that groundwork for the webinar later this month. So, our ACO audience can start thinking strategically about what they might need and also what they need from that conversation.
Right. We'd love for folks to come to the webinar with questions so they can get the most out of it.
Yeah, and I'm going to share that link, folks, to register for the webinar in a few minutes. I'll put that in the comments. But meanwhile, as you're watching live today, please feel free to comment with any questions and experiences you have right now, and we'll address them as we go. And so, also, if you're watching in the replay, if you're joining us later, not during the live broadcast, if you leave a comment with any questions, we'll reply. You can also send us a private message if you prefer to be anonymous. That's no problem. And you may see me looking over there sometimes because I'm reading those comments. And so just to make sure everyone knows what's up, go ahead and give us a react on the video or give us a comment and let us know that you are with us. So, Patrick, there are 5 categories of behavioral health professionals that ACOs need to consider to align their workforce to the needs of their community. Can you walk us through those 5 categories?
Absolutely. First of all, we need people with medical training who can address medical comorbidities.
Mhm.
Remember what ACOs are, these accountable care organizations. They're accountable for the whole health of the person. So medically trained folk can address psychotropic medication needs of patients with mental health conditions, the medication assisted treatment needs of patients with substance use disorders like opioid use disorders.
Mhm.
These are our prescribers. Generally, they're MDs or DOs. They are our physician assistants, our nurse practitioners. We also need people who are very well equipped to provide really robust psychological evaluations and valid diagnoses. So these are our PhD psychologists. This is really critical for things like creating an education plan for children in a pediatric setting, um, or assessing the fitness of somebody to stand trial in a forensic setting, not to mention the general assessment, diagnosis, and treatment of our patients. The
Mhm.
third category are those people that are credentialed, trained, and licensed to provide bona fide psychotherapy or traditional counseling services. Now, this might include the PhD psychologists we were talking about to some extent. It'll also include what are called PsyDs, licensed clinical social workers, especially, and licensed professional counselors or LPCs. They're slightly different nomenclature in different states, not to worry. The fourth category are those professionals who are certified to treat alcohol use disorder, substance use disorders writ large. So these are our CADCs, or certified alcohol and drug counselors. And more recently, there's a fifth category of paraprofessionals. These include folks that are providing case management and peer support. Case management is almost always a function of a bachelor's in social work or BSW degree. The certified peer
Mhm.
specialists that some of you may have heard about, that's a role that's emerging and getting more clearly defined, but for now, training and credentialing varies pretty significantly by state. And these paraprofessionals can be enormously helpful in dealing with people who are either in recovery or seeking treatment, seeking recovery.
Well, and that's a really important point. The names for these roles may vary depending on where you are, depending on the credentialing that's required by your state. But these are the big categories of roles. And for those of you who are watching live and also in the replay, I put those categories into the comments as Patrick was speaking. So, Patrick, looking at these five different categories, how do we figure out who we actually need on the bus for us to move forward?
Right. Well, the first place I encourage people to look is at their own data, and ACOs in particular, being large integrated delivery systems, tend to have very good data. And looking at their data, both in their EMR system, electronic medical record or health record system, or in their own claims data, they can see primary, secondary diagnoses. They can
Mhm.
look to their own utilization patterns, how many people are coming through the ED, how many people might be coming through pediatric setting, and so forth. And they can examine their own prescription data as well. So that's the first cut.
Okay, so then looking beyond that, if we want to see the needs of the community overall, not just the patients that we've encountered, what's the best source for that broader data?
Great question. And this is one that confounds people. So far, in every state, I've done the research and I've had 100% success in finding this kind of data. So it can be found. That's the good news. It tends to come from, yeah, good news is we'll take all the good news we can get. But state epidemiologists, for example, produce all kinds of data. And looking for in your state the epidemiologist reports pertaining to behavioral health is a great place to start. The other is that federal agencies responsible for health and behavioral health, like SAMHSA, they provide all kinds of data. CMS has a very robust data set, as does SAMHSA, what they call their treatment episode data set, or TEDS.
Mhm.
And all of that data is available on a state by state basis. And then, of course, there's a lot of research conducted by your local universities and foundations, and they produce reports. The other option for people are what I call data aggregators. Now, these are websites that have gone up, but really in the last 2, 3, 4 years, where you can drill
Mhm.
down on multiple sources of data that have been aggregated right down to your own county and city level. So, for example, if I needed to know how many people with opioid use disorder I can be treating in my county, in my program, I can find that information at that level of granularity. It's available.
So you can really drill down through these. Are there any specific ones that you would recommend? I can put the links in the comments for those.
Sure. Yeah. The ones I turn to first and foremost are the following: health system tracker.org,
Mhm.
city health dashboard.com,
Okay.
disability compendium.org, the neighborhood atlas from University of Wisconsin at Madison, and finally, and this is one of my favorites, county health rankings.org.
Okay. I'm going to put these links in the comments. One second. All right. So here they are in the order that Patrick listed them. These should be clickable links for you. And so, Patrick, thank you. Those are going to be great resources. Now, once we have the data, we can clearly visualize what the overall need is. And then how do we translate that data into decisions? Who needs to be at the table for that conversation?
Sure. No, that's a natural next question. You're going to want to start by talking with your own professional, medical, or clinical staff and to find out what they believe is most needed in terms of behavioral health staffing. Uh, and then it becomes a strategic question from there. Do we or should we hire or train all of the professional staff that we need to provide this service in-house? Or should we refer this service out into the community? And it may be a bit of a hybrid.
Well, that's a really important question because the answer is going to depend heavily on the type and the scope of our program. What might work for one program may not work for another because they have just totally different focus areas.
Right, different focus areas and different assets in the community.
Yeah.
So you have to really think through this strategically. Is there a there? It's
Mhm.
just purely a business question at this point. Is there enough demand in the community to justify my investment? Is it reimbursable, the particular service we're talking about? At what rate is it reimbursable? Are
Mhm.
we as an organization, as a business interest, are we going to make a margin, enough money to continue providing this particular service, or is it going to cost us more than it brings in? And so conducting that cost benefit analysis is critical.
Yeah.
In some cases, you have to look to a strategic partner so that the care, you might not be providing it directly, but it gets provided in a closed container or a vessel where that patient won't fall through the cracks.
That's so crucial for ACOs because the cracks, I mean, that's the whole thing that ACOs are designed to address, right? We don't want people falling through the cracks. So if we're going to be making referrals, we need to do it strategically so we're not creating new cracks that patients are going to fall through.
Exactly. Now you're spot on. Non-strategic referrals, if I hate to say it this way, but willy-nilly making referrals out into the community, just using a list and sending people out the door, that creates a type of leakage. And what's leaking in most cases is money, is intelligence, including
Mhm.
clinical and business intelligence. It could be that you're leaking qualified staff, that they're leaving your organization, going to work somewhere else, or that they're not choosing you in the first place. Uh, and then, of course, I think what's leaking too is a relationship with the patient that allows you to provide truly coordinated care. ACO remedy that leakage by design by creating a container for that care provision that doesn't have any leaks. And yet there still are some ACOs that think, well, we'll contain everything really tightly with the exception of behavioral health. And we'll refer that out as if it's only marginally or tangentially important. And I'm here to say that behavioral health is absolutely essential to everything else you're trying to do with that patient. You can't effectively treat a wide range of chronic conditions that are part of your risk profile, the risk profile of the population you're serving, without also addressing chronic behavioral health conditions.
Mhm.
And ACOs, I think, are the answer to all of the fragmentation problems we have, but only if we're truly being strategic about it and trying to contain as much, including behavioral health, as we can.
Right. So how do we know if the strategy is working, Patrick?
Well, we have to look back at those numbers that we were looking at originally, and if in most cases we're keeping tremendous amounts of data, and we have the analytical skill set in place to look at that data, go back and see, is what we're doing working? Are we having an impact on utilization? Are we having an impact on outcomes? Are we having an impact on the clinical pathways that people are following? How
Mm.
many people are we reaching? What services are we providing them? We need to look at our own EMR data. We need to look at our claims data, and of course, look at outcomes data. Let me give you an example. We know that patients with diabetes are roughly twice as likely to suffer from depression than patients who don't have diabetes. And so that's an easy comorbidity, right? The
Mhm.
question is, are we treating the depression that's resident in folks with diabetes? And are we treating it in a way that makes sense for us, for the patient, and our community? And the claims data and other data we have and the revenue data are going to help us answer both those questions so that people who are struggling to live with diabetes can truly improve across the board as a whole person.
Mm. Patrick, we mentioned at the beginning of this conversation that on October 28th, you and our colleague Fran Beisch are going to do a webinar on workforce development planning for ACOs. Can you tell us a little about the webinar?
Sure. The webinar is really going to be focused on a tool that we're going to be providing people who show up to the webinar. And so I encourage you all, please join us.
Mhm.
And we're really going to look at the link between your population health management aspirations and goals and objectives as an ACO, or perhaps a provider in an ACO construct, and the behavioral health workforce capabilities that are resident today and that you might need to develop in the future to meet those goals and objectives. So that's really our focus. And we'll look at all of the dynamic steps involved in getting to a true workforce development plan. We're going to come at it from a pretty formal standpoint in terms of what is a workforce development plan, how do you build that plan, and how do you execute on it.
And you mentioned that there's going to be a tool that's available to folks at the end of the webinar. Can you tell us about this planning template that you're going to provide?
Sure. Yeah, that behavioral workforce development plan, as I said, will be the focus of the entire webinar, and everyone will get a copy of that tool, and then of course the instructions and how to use it.
Mhm.
And what we're going to challenge people to do with this particular tool is to through what they need, both in terms of pedigree, credentials, all of the different staff categories that you and I talked
Mhm.
about at the top of the this particular presentation, but then also to ask ourselves, are there people that we can train? If we have them on staff already, are these people that we need to recruit? How are we going to recruit these folks? Getting people in senior clinical positions who are thinking about a program they want to start, get them thinking a little bit more like a human resource professional, so
Mhm.
they start to understand how they're going to staff their particular program And again, this all aligns with the true level of demand for that program in the community, the viability of the program in your ACO.
And so this tool is really going to help the folks who register create that map, really map it out step by step so they know exactly what their next steps are.
Absolutely.
Awesome. Okay. So, folks, that's a free 1 hour webinar. It's going to be on October 28th at 12:30 p.m. Eastern. So, the same time that we typically do our live broadcasts here, but it's actually a webinar. So, it won't be on Facebook Live. I'm going to put the link to register in the comments here. So, let me do that. So, click on this link, go ahead and fill out that registration form. There's no charge. You'll get a confirmation email that has the information to attend on the day of. I'm also going to put that link in the video description. And I want to encourage you, I know you're all really busy and you have something to do immediately after this. So go ahead and click that link and just take a minute to fill out the form and get registered so you don't forget and miss it when you walk away and go to your next meeting. So, Patrick, going back to the example that you shared with us in the beginning, what happened with the detox program you were telling us about? Did they end up expanding outpatient services or did they go in a different direction?
No, they really did a great job, and they now provide a wide range of outpatient mental health and substance use disorder services. And of course, remember this program was reacting to the opioid epidemic, and so much of what they're
Mhm.
providing on an outpatient basis today is very effective medication assisted treatment, complemented by wonderful outpatient counseling in the form of individual and group counseling. And among the many benefits they accrued in the process is the ability to transition their detox patients into their own outpatient program, and
Mm.
in the process avoiding readmission to the emergency room to a greater extent than ever before. That dynamic has really changed for them. It's been a huge success.
That's a great example of how the strategic thinking about the services and the workforce can really create that container and reduce fragmentation. Because I don't know what happened before, but if they didn't have those outpatient services, they were transitioning them somewhere else. And now it's just another part of their program for that continuity.
It sure is.
Yeah. Well, Patrick, thank you so much. I'm really looking forward to this webinar on October 28th so we can really dive deeper into this and get a concrete, actionable plan in place for how ACOs can build and align their behavioral health workforce. And again, everyone, that link is in the comments. So go ahead and click on that and get registered so you don't miss it. Patrick, it was so great spending time with you today. Thank you as always. Folks, I
Likewise.
am Kristen King on behalf of my colleagues at AHP and my online events team. Thank you for joining us. I'm going to pull up the information about that webinar on October 28th, and we do hope that you will join us. We will see you then with Patrick Gauthier and our colleague Fran Beisch, and we will also see you next time for Whiteboard Wednesday. Have a great rest of your day. Bye now.